Accidents are inevitable. They can happen anytime and anywhere. Thus, knowing how to provide first aid accurately is important. So, what is first aid then? Well, it is the immediate and temporary care given to a victim of an accident or sudden illness until the service of a physician can be obtained. It helps in reducing suffering and obviously making the task of the physician easier. Home treatment for animal bites. Usually, when people get bitten by an animal, they want to know right away if getting a rabies shot is necessary because rabies is fatal if not treated. At home, you can scrub the bite immediately with soap and water and then treat it as a puncture wound. If you are bitten by a pet dog or cat, find out whether it has been vaccinated for rabies. And then, the healthy pet that has bitten someone should be confined and observed for 10 days to see if it develops symptoms for rabies. It is important to contact the local health department for proper animal observation. Lastly, if you are bitten by a wild animal, contact the health department to determine whether a treatment is necessary. Treatment for fainting. Fainting is a signal of an underlying problem. It warns that something is wrong inside the body. It can be a sign of danger to the heart or brain, a panic attack, hyperventilation, malnutrition, or even pregnancy or menopause. And if you see someone fainted, you can do the following. Number 1. Lay the person down on the floor on his back. Number 2. Practice your ABC of first aid. Make sure that the airways are clear, that a person is breathing, and the blood is circulating. Number 3. Loosen clothing if necessary, to make sure that the victim is comfortable and able to breathe clearly. Number 4. Open windows when inside a building to allow air to circulate. Number 5. Turn head to the side and wipe the mouth with a piece of cloth if victim vomits. Number 6. Keep chin up to prevent the victim's tongue from obstructing the throat. Number 7. Wipe the victim's face with a damp, cool piece of cloth. And number 8. If the victim remains unconscious or conscious but groggy, disoriented, and feeling dizzy, it is best to call for medical help. Water rescue and reviving someone who has drowned or swallowed water. One of the most common causes of accidental death is drowning. This can be due to heart attack or stroke that causes unconsciousness, or head injury caused by diving into shallow water, or cramps that cause panic. How to do the water rescue? Number 1. If a lifeguard is nearby, let him do the rescuing. Otherwise, shout for help as loud as you can. Number 2. Try to reach the injured person without leaving the shore. Use your arm, life preserver, rope, or rescue pole or anything that can float. Number 3. Hold on to something on solid ground with your other hand to prevent yourself from getting swept away by strong currents. Number 4. Locate a boat and find someone to assist you to reach the victim from the shore. Number 5. Even if you're a good swimmer, always have a flotation device with you. You can give this to the victim to hold onto as you swim back to the shore. How to revive someone who has drunk or swallowed water. Number 1. Turn the drowning person's head to the side, allowing any water to drain from his mouth and nose. Then, turn the head back to the center. Number 2. Begin mouth-to-mouth resuscitation on land or in the water if the injured person needs immediate life and death measures. Number 3. Strongly breathe 4 times into the mouth of the injured person as you pinch the nose. This helps air to get past any water that is clogging the breathing passageways and the lungs. Number 4. After 4 strong breaths, put your ear near the mouth and watch the chest for any breathing movement. Number 5. Check pulse for signs of life. Number 6. Repeat the cycle. And number 7. Take the drowning victim to the hospital for further medical help.